Welcome to The Pulse, the official podcast of the Georgia State Medical Association.
Hello, hello, hello. Welcome and welcome back to all of you who wanted to join us today. I'm again Dr. Kimberly Williams, the Executive Director of the Georgia State Medical Association. The Pulse podcast is where community meets conversation, and today's episode is Seeing the Signs, Diabetes Through the Eyes. And our podcast guest for today is none other than Dr. Ninita Brown. Hi there, Dr. Brown. Welcome.
Hi, Dr. Williams. How are you doing?
I am excellent. Thank you for being here. So let me get started and give you all some background on Dr. Brown, who she is, her illustrious education, and where she comes to us from. So Dr. Brown, MD, PhD, earned her Bachelor of Science degree in mathematics at Spelman College, a Bachelor of Science degree in electrical engineering at Georgia Tech. Her medical doctorate is from Duke University, and while at Duke, she also completed a doctorate of philosophy in biomedical engineering. Wow, that is impressive. Dr. Brown completed her internship at Santa Clara Valley Medical Center, the county hospital affiliate of Stanford University. She then completed a residency in ophthalmology at Howard University in Washington, D.C., and she completed her glaucoma fellowship at Duke University. During her fellowship, Dr. Brown received specialized training in glaucoma treatments and surgery. She also trained Duke residents at Durham Veterans Hospital. She currently sees patients in and around the Atlanta metropolitan area. And even more impressive, Dr. Brown began participating in multiple medical missions to India, Haiti, and Ethiopia. Absolutely impressive. Wow, Dr. Brown, thank you so much for being here.
Thank you for having me.
Well, I had no idea, but let's just kick us off and get started because I know our communities, our patients, our friends, our family, they want to know, and many of us don't know. How does diabetes affect the eyes?
So, diabetes is a systemic disease where patients are affected by their diet, their high blood pressure, and all of these things can play out in their vision. So, moving from the front of the eye to the back of the eye, you can have dry eye, you can have issues with cataract. Diabetic patients get cataract when they're younger. And as we move to the back of the eye, which is the part retina specialists are very concerned with, you can get bleeding and swelling in that eye. Um, Also, patients who have advanced diabetes in their eyes can develop glaucoma, and that's when they come to see me. Glaucoma is a disease of the nerve, and what happens in diabetics is the natural drainage system of their eye doesn't work as well, and there can be blood vessels that grow over that drain, and the eye pressure can go up and then damage the nerve. So when they have this neovascular new blood growth glaucoma, it can be very, very problematic and very, very dangerous and sight threatening. So diabetes affects the whole eye, just like it affects the whole body.
Wow, so who knew diabetes has similar effects in the eye? So you talked a little bit about age being a factor. Would that also impact younger people or more seasoned folks, our seniors? What age would we expect our eyes to be impacted by diabetes or glaucoma, as you've just talked about?
So there are two different types of diabetes. Type 1 diabetes is usually in younger people. Those diabetics will experience vision changes, vision loss a lot earlier. So we worry more about the type 1 diabetics. Type 2 diabetics are patients that are a little older, have developed diabetes, usually in their 30s to 40s, as opposed to a child having type 1 diabetes. Type 2 diabetes usually presents a little later. The difficulty is when you are first diagnosed with diabetes, you need to have an eye exam. That is the overarching theme to all of this. And not only do you need to have an eye exam, you need to have an eye exam every year, especially if your diabetes is not well controlled. So, in kids who are developing diabetes at a younger age, and it's scary now because we're seeing children develop type 2 diabetes, which is a phenomenon of the change in the diet, the change in the activity levels of children. And so when they're developing these diseases a lot earlier, we're having to do cataract surgery a lot earlier. We're having to do treatment for the bleeding and swelling and changes to the retina a lot earlier. And so being able to pick up these changes and treat diabetes more aggressively, is really the most important thing. So once somebody is diagnosed with diabetes, they need to go and see an ophthalmologist and get a dilated exam so that we can check to see if there are any blood vessels that are growing, any swelling to the center of the vision. So those are the most important parts of diabetic eye care.
So you've shared a little bit with us about younger individuals or children. Tell us about seniors. Clearly, getting the eye exams every year is extremely important, but tell us if for seniors, is it still every year, or is there a more quick, sooner time, shorter time frame? How does that work?
For seniors, it's even more important because we know that falls, um, difficulties in navigating, whether it be driving or, whatever transportation, um, that they may be using, it becomes more and more difficult to manage your other comorbidities, whether it be high blood pressure. All of these things are more and more difficult as you get older and can be even more difficult in the senior population if they're having changes to their vision because of diabetes. So, definitely, patients who have had diabetes for a longer period of time become at higher and higher risk for having some of the diabetic retinopathy or changes to the retina because of their diabetes. So it is extremely important in our senior citizen population for them to have diabetic eye exams at least every year. Because we can also pick up on other things. We can pick up on cataract. We can pick up on dry eye. We can pick up on any glaucoma changes. All of these can be diagnosed with the eye exam with the ophthalmologist.
Wow, that's a lot. So there's a couple of questions that have just resonated in my mind. You specifically mentioned ophthalmologists. Many of us don't know, and I'm sure others have this question, what is the difference between an ophthalmologist and an optometrist?
So we're all part of the eye care team. And the ophthalmologist is actually the surgeon. So we do cataract surgery, the retina doctors that specialize in retina. There's also doctors who specialize in plastic surgery. There are ophthalmologists that specialize in pediatrics. But the big difference between the optometrist and the ophthalmologist is that we are doing surgery. So I do cataract surgery, and I am able to diagnose all types of different diseases and then go on to treat them in a surgical manner. So the optometrist, more of their focus can be screening, more of their focus can be glasses, contact lenses. But when you need surgery and you're worried about advanced disease, then it's best to see an ophthalmologist. Specifically, if you have uncontrolled diabetes, or if you have family history of vision loss or glaucoma damage, it's always good to see the medical doctor. So we go to medical school and we do a residency in ophthalmology. And then for someone like me, I did a fellowship in glaucoma, whereas a retina specialist would do a fellowship in retina.
Wow, that is pretty sophisticated, but extremely helpful. So, would you recommend if someone doesn't have signs or symptoms of diabetes, at that point, they could probably see an optometrist and be pretty safe, is what you're saying then?
I think that if it's just for glasses or standard care, you're not really worried. You don't have any changes to your vision. You're not losing vision. Your diabetes is under well control. Those type of patients for routine exams, they definitely see optometrists. We have optometrists on our team. But in a lot of cases, the patients will need elevated care, especially if they don't have controlled diabetes, or if they're starting to have vision changes. Um, I even refer patients on to the retina specialist when I see diabetes in the eye, because they are able to do a lot of different treatments, and are on the cutting edge of all the different treatments for diabetes in the eye.
Okay, that is extremely helpful. So another question I have, and especially for our community, there's lots changing right now with our administration and healthcare questions, and some individuals just don't have access to physician care, such as yours. What alternatives would you recommend for someone to get some sort of help or assistance who may not have health insurance or access to a system or the ability to see a physician like yourself?
Well, here in Atlanta, we have a wonderful hospital. Grady is an excellent hospital. They have a new eye center, and they see patients who are dealing with lack of insurance and lack of care. The Grady that Grady Health System has a new eye center, um, and there are physicians from Emory that go and work in that eye center. And so that would be, if I was a Fulton County resident, that's where I would start. I would start with getting into Grady and being part of that system, because they can allow you access to different specialists, allow you access to the Lighthouse, which is a wonderful organization here in Georgia that is able to give glasses. We also have Prevent Blindness of Georgia. They do mobile clinics and can give access to care and referrals to different people here in Georgia.
Wow, those are such helpful tools, tips, places for us to go. So we will share some of that information at the end of the podcast so that individuals know where to go and what they can do if they don't have insurance or they don't have the ability to go. But those things are so helpful. Thinking about individuals who may not have access, or there may be individuals who are afraid to see the ophthalmologist or the optometrist. Are there any myths or misinformation you've heard from individuals, from patients, that may be helpful to share with us today, to share with our viewers?
I think the biggest fear that a lot of people come in with is that we're going to blow air into their eye, that we're going to dilate them and then they won't be able to function. there are a lot of fears around some type of permanent blindness from us doing our exam or shining light in their eye. And I think that a lot of times people can be very afraid to have someone in their personal space and very anxious. I hate going to the dentist. So I understand completely. And I think one of the big benefits of being a doctor and being a surgeon is meeting people where they are. And so I think if you don't feel comfortable, then we're not going to be able to build a relationship. And I have relationships with my patients. And I like to think of them as my family, and I treat people the way that I would want my family members to be treated. So I think that it's important for you to express yourself and to be very clear with your doctor about what you are comfortable with, what you're not comfortable with, what you're worried about. And having that type of conversation is going to allow them to be able to take care of you better and understand your needs.
Wow, Dr. Brown, I will say this. That's the benefit, I believe, of seeing a Black physician or someone who looks like you, who thinks about their own family members, their parents, their siblings, their children. That is so helpful. And so I appreciate you adding that piece. Let me move over to a space around treatment. You mentioned surgery. I've heard some things about eye injections, laser treatments. Are those things still relevant? Are they helpful? Give us a little insight into that space and what those types of treatments do.
So the first treatment for diabetes is lifestyle modification, diet modification. So every diabetic that I see, I say, Are you exercising? What are you eating?" Because those two things are the best way to cure this disease, to treat this disease. So we want to make sure that people are exercising at least a half an hour every day where you break a sweat. Okay, so this is not leisurely walking. This is exercise where you're breaking a sweat. Okay. You also want to move away from food that's processed. So things that aren't from a bag, a box, a can, things that are more natural food, raw food, moving away from processed meats and processed vegetables. When you get to the stage where you have diabetes in your eye, we have a lot of different treatments, and lasers definitely come into play for patients who have advanced disease. But we have wonderful medications now that involve decreasing the amount of blood vessels that are growing in the eye, involve decreasing the amount of fluid and swelling that we have in the eye. And these involve injections. Some of them may be monthly. Some of them, we've gotten better. We have newer medications that last longer and longer. And so patients definitely are afraid of the laser. They're afraid of the injections. But I always go back to the universal truth of, if you change your lifestyle and you change your diet, then we can get a better hold of the diabetes. And I've seen it before. I've seen patients who are so motivated by the fear of losing their vision that they change their lives, and they are able to save their sight.
Oh, that's important. That gives us hope. And so I really appreciate you sharing that piece, that with lifestyle change, with certain treatments, that there really is hope. And that's a message that we need to share. That's such an important message that I don't think we talk about as often as we should. So, the injections. How often would individuals who have reached a stage where they need these injections have to have injections?
So it depends on the severity of their disease. So there are some patients that will have the injections monthly. Some patients we can watch and wait. And then some patients, like, they'll get an injection and they'll be fine. So it just depends on the severity of the disease. Um, and the retina specialists, they have different protocols, they have different medications that they can use. One medication that may work in one patient may not work in another patient. And so being able to individualize your care and being able to have a relationship with that retina doctor. In some patients, they can't keep coming back every month because of their social determinants of health, different challenges that they have. And so laser might be a better option for them. In certain cases, they do have to do surgery. So for those patients who have blood that is in their eye that is not clearing, the retina surgeons will take them to the operating room and remove that blood and then do the laser in the operating room.
Wow, that's phenomenal. There's a lot there. But again, we have hope, and we're just thankful and appreciative for physicians in your space who can educate, who can treat these diseases, who give us some options, some recommendations to help us be more healthy. So, talking to our listeners and our community members, what's one thing that you wish every listener with diabetes or caring for someone with diabetes would do after hearing this episode?
Get an exam. That's where we all need to start. So if you have not had your diabetic eye exam, that is where we need to start. There are a lot of different tools that we have now. I think at some point we'll be able to take pictures of people's retina and run it through AI and tell you where you need to go and what you need to do. And, all of these things will be a lot more accessible in the future. But I think at this point, I would uh, highly suggest for anyone who has been diagnosed with diabetes to get an eye exam if they haven't had one in the last year. So it's not just about patients getting seen, it's about the continuity of care. And it's about making sure that we are compliant, making sure that we are on top of our health. And I think part of that is making sure that you're seeing that you say, okay, every year I see Dr. Brown, October. Every year I come to see Dr. Brown, November, because it's diabetes month. Every November, I'm going to go see my doctor and check in. And you can lose track of time. Ever since COVID, it's like we're all trying to keep track of all of these different things that we have been not able to do and that have changed. And I think specifically, for the eye exam, it's going to take a couple hours. It's going to be a process. But I think it's very important because we are able to treat these diseases if we catch them early enough.
Excellent. So I'm going to reveal something about myself, not my age at this point, but dry eye syndrome or dry eyes. You mentioned that a couple times. I am not a diabetic or diabetic person, but what does dry eyes mean for someone at my age, or what? How should I be addressing that?
So anytime you feel that you are aware of your eyes. So if you're aware that your eyes feel irritated or scratchy or itchy, or you shouldn't be walking around with that type of awareness of your eyes. And we've seen an increase in dry eye, whether it be from environmental factors, right? We are, you talk a lot about climate control. We have a lot more changes in the environment that we're in, whether it be, you're working inside or you're working in a dusty environment or you're working outside. And, all of these different variables can play into how your eyes feel. Also, people are doing more screen time, right? So when you're on the computer all the time, you're not blinking as much. Also, as you get older, you can get dry eye secondary to other medical conditions, right? So if you're on high blood pressure medications, or if you're perimenopausal, or if you have other symptoms like autoimmune disease, like Sjogren's is one of the classic diseases that is very common for people to have dry eye, or thyroid disease. All of these different things can play into you feeling your eyes, feeling like there's something in them, feeling sensitive to light, feeling sensitive to the environment more than you have before. Just comparing yourself to when you were younger, or when you were in a different environment, and how you didn't have that same kind of sensitivity.
Wow, that is helpful. So I am now aware of that. I will think about that now when if I feel my eyes or something going on with my eyes, that's a time to get them checked out, schedule an exam, be seen by someone. Extremely important. So I'd have a few more questions, and then I'll ask you your last question, or whatever closing remarks you have.
Okay.
One, thinking about community leaders, family members, how can we work together to reduce preventable blindness? Because we see folks who maybe you can't get them to an exam, whatever the situation, they can't, the transportation could be an issue, busyness, family, children, other things that take away their time. So what can we do, our churches, families, communities, what can we do to ensure that we're reducing blindness in our community?
Well, I think a lot of the preventable blindness, right? The things that we can, as a member of the community, that we can reach out and be resources for people. Um, it's always good when you go into a doctor's office and someone is there with the patient. So I think if you are, in a community and you're able to kind of support patients who are struggling with different diseases, whether it be eye diseases, or heart problems, what have you. I think it's important that we take care of each other, neighbor to neighbor, and try to build communities of support. I think at a larger scale, organizations like Prevent Blindness, they do a lot of research, a lot of outreach, a lot of screenings for children. Like every child in Georgia gets screened to make sure that they have the proper glasses that they need. The problem with kids is that they break glasses all the time, but we do our best to try to get them in their first pair. But I think we have to have bigger organizations that are invested in making sure that there are healthy eyes across the nation.
Wow, that's a really nice thing to say. And it just sounds like the community of optometrists and ophthalmologists are really working to ensure that we do have healthy eyes and healthy eyesight. So that leads me to a question. What gives you hope about the future of diabetic eye care?
Well, I am a member of the National Medical Association, and I was past chair of the ophthalmology section. And we have a program called the RAB Venable program, and it's for medical students and residents who are going into ophthalmology. And this past weekend, we did practice interviews for these students to be able to get into residency, because they're starting to interview for residency. And they are brilliant, absolutely brilliant and creative. And I was teasing them because I said, you guys are way smarter than me. And it's just such a delight. And I'm always teasing the next generation of doctors. I'm like, they're going to steal my job, because we have such talent coming through the pipeline. And if we increase our workforce and we increase the ability to educate the next generation of physicians who care about underserved populations, about rural communities, and we're able to tackle all these challenges in creative ways, there's so much hope for the patients. I also am very excited about Ozempic. And all of these new medications that are coming out, because I think that is going to push the wave and kind of slow down the disease. And so I'm excited about the future of medicine. I'm excited about this next generation of physicians and surgeons, because I mean, there's going to be all kinds of developments, whether it be robotics or artificial intelligence. And I think if our communities have access to this and we're able to overcome some of the social determinants of health, then we will be healthier than we've ever been.
Wow, that is absolutely amazing, phenomenal. Thank you for that information as well. I hope we have some of our younger community members, students, individuals who are watching our podcast and are learning and getting excited about potentially going into medicine,
Yeah.
reading your bio and just thinking about where all of the things that you did, which were phenomenal, from undergraduate, medical school, your fellowships. You've just done so much, and it sounds like you've really helped students and residents reach the level that you're, or even getting ready to reach that level where you are.
Yeah, it's
So
exciting. It's really exciting. We just need more talent. I go back to my alma mater, to Spelman at Georgia Tech and Duke, and I'm constantly trying to get people to come into medicine because it is a wonderful profession, and especially ophthalmology, because you can take someone who is completely dependent, not able to see, and with your surgery and with the tools that and the grace of God, you're able to make them see better and function better and re-engage. People thank me all the time and are happy all the time because we're able to give them sight. So it's a blessing to be able to be an ophthalmologist, and I just really encourage people to look into it and definitely get your eye exam.
that is so positive. I'm excited about ophthalmology. I'm excited about my next eye exam. I think you've motivated me. So, and I hope you've motivated our next generation of ophthalmologists and surgeons. And one thing I want to, before we close up, I want to ask you, I heard you somewhere else in another space talk about the number of Black ophthalmologists in the country, I believe is the number you use. Can you tell us what that number is? I think people would be surprised, or maybe not, but if you could share a little bit with us on that note.
So there are a little under 400 Black ophthalmologists in the United States and Caribbean, and that number has been flatline since the 1970s. So as we are producing Black ophthalmologists, they are retiring. And so we are actively, for the last 20 years, the Rad Venable program has been around. And the American Academy of Ophthalmology has also started a mentorship program. It's called the Vision Program. And all of these programs are available to students in medical school to try to get them exposure to ophthalmology and ophthalmology research, because we definitely have a pipeline problem in ophthalmology. And I think that it's important, like you said before, that we have these relationships with the community so that people can see me and they can know that this is something that they can do. And so I this is, you're preaching to the choir. Like, this is my mission, is to try to make sure that people have the proper mentorship and the proper training to be able to take my job. That's the future, is to be able to have highly qualified people to be able to take on this field and be very, very good and try to, stomp out blindness, as we say, to try to make sure that patients are able to live and see well.
Excellent, excellent. Well, thank you again, Dr. Ninita Brown. We are so appreciative and glad to have you here sharing all of this wonderful information about the diabetic eye and our younger folks, our more seasoned individuals, and those of us in the middle. So again, thank you so much, and we appreciate you, and we look forward to having you back in the very near future.
Thank you, Dr. Williams. I appreciate the pulse. This is awesome. I am so proud of this organization. Georgia State Medical Association is doing great work. Thank you again.
The content shared on this podcast is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by our guest and host are their own and do not necessarily reflect the official positions of GSMA. At GSMA, we stand on over 130 years of medical excellence and advocacy, but we encourage you to always consult your physician or qualified health provider with any questions you may have regarding a medical condition. If you think you may have a medical emergency, call your doctor or 911 immediately. Until next time, stay informed, stay empowered, and stay well.